Every year, about 15,000 Missourians die from heart disease, but there are ways to reduce your risk.
In Focus on Your Health, Teresa Snow shows us how a screening can help uncover serious issues before it's too late.
Focus on Your Health is sponsored by MU Healthcare.
According to the CDC, about 80% of deaths from heart disease and stroke are preventable. That's why getting screened and learning your risk factors is so important. Steve Mudrick likes to keep moving. 3 times a week, the retired professor jogs 15 laps.
So I've been doing it for 40 years, 40 plus years.
But about this time last year, while at the ARC for a free heart health screening, a scary incident stopped him in his tracks.
I felt like I was going to pass out, and I did.
Dr. Mary Dohrmann jumped into action.
I immediately responded. I felt for a pulse, checked whether he was breathing, and started CPR. He basically didn't have a heartbeat for about 60 seconds.
Steve was revived, lucky to be in the right place at the right time. At a heart health screening, patients come to learn about their risk for heart problems. They're weighed, find out their body mass index, a measure of obesity. They get a blood pressure check, and finally, a blood test, which measures cholesterol levels. The goal? Prevent cardiovascular disease, the #1 killer in Missouri and nationwide.
We can show people that by reducing blood pressure, by reducing cholesterol, we actually reduce their risk.
Steve ultimately learned that his heart problem was electrical. Today, he's got a pacemaker, and he still hits the track regularly and encourages everyone to get their own heart checked out.
As you get older, these things start to develop. So it's a good idea to know about these things because you don't really feel them.
And a screening is a good first step. Joining me now is Dr. Mary Dohrmann, director of the cardiology clinic here at MU Healthcare. What are the things that all of us need to think about to live a heart-healthy lifestyle to reduce our risk factors?
7 simple things, really. Exercising, staying active, at least 150 minutes of mild to moderate intensity exercise every week, eating healthfully, attaining an ideal body weight, keeping cholesterol under control, which diet and exercise help with, lowering blood pressure to normal levels, keeping blood sugar under control. There's an epidemic of obesity and diabetes, especially in Missouri, and so we really, really need to stress keeping blood sugar down, and finally doing something extremely important. Never smoking, or if you smoke, quitting.
Absolutely. Sometimes people avoid seeing you. I don't know why they would, but what would your message be to people about listening to their body?
Well, our bodies tell us everything we need to know about ourselves. And in particular, if you're doing all those preventative things, especially exercise, your body will give you signals that says something's different, something has changed. So if you listen to that based on what you were and now something new, that should be brought to the attention of a physician.
Don't avoid it. Okay.
Absolutely.
Thank you very much, Dr. Mary Dohrmann. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.
MU Healthcare is offering free heart health screenings this Saturday from 7 to 10 a.m. at the ARC in Columbia. For more information or to register for a cholesterol screening, find the story under the Focus on Your Health section on krcgtv.com.